Okay, so social history. Are you married?
Yes, I'm married to my husband, and we have 2 children and 2 beautiful grandchildren.
Okay. Do you work anywhere?
I do. I'm a supervisor at a specialty clinic.
Okay. Would you say that's a high stress environment that you work at?
No, not particularly.
No. Okay. What about any social habits like smoking, drinking, recreational drugs? Do you use any of that?
I do not smoke or I do not do any drugs, but I probably have 4 to 5 drinks socially each month.
Okay. What about any sort of regular exercise? Do you go out and exercise at a gym or take a walk, anything like that?
Not really.
Okay. All right. What do you like to do in your spare time?
I love to read, and I do love to travel.
Okay. All right. And you said you were married with your husband. Do you live in a house or an apartment or townhouse?
We live in a townhouse.
Okay. Is there stairs to go into there?
We have an upstairs, a second floor.
Any shortness of breath when you climb up those stairs at all?
Not really.
No. Okay. And let's see. I'm just going to ask you a couple of questions about your general health. Do you have any dizziness at all?
No.
Have you lately? No. What about a cough? Any coughing?
No.
No. Any increased tiredness? Have you been tired a lot at all?
No, not that I can think of.
Okay. Fever. Have you noticed any temperature?
No.
Chills or night sweats?
No.
No. Have you had any unintentional weight gain or weight loss that you've noticed? No? Okay. How has your appetite been? Has it been okay?
Yeah.
Yeah, nothing out of the ordinary?
No.
Okay. What about do you have regular bowel movements and
yeah.
no problems going to the bathroom with urine?
No problem.
Okay. What about nausea, vomiting, anything like that?
No.
No? Okay. Any headache pain?
No.
Any recent illness besides this chest pain that you've had? No? Okay. No blurry vision?
No.
No. Have you noticed any swelling in your hands or feet?
No.
Okay. Now, have you had any immunizations at all? I see you haven't been to the physician in about 5 years. Have you had anything like that? No. Any sort of physical in between there or checkup? Okay.
No.
So I'm just going to take a quick peek at you then, okay? I see that my medical assistant was in earlier and checked your vital signs. Your blood pressure was a little bit on the high side. It was 142/92. Let's see, I also have your heart rate was at 80. Your respirations were okay at 16. No temperature at all. I also had your height and weight done as well. So I'm just going to take a peek at you. I'll start with your neck, okay? Have you noticed any lumps or bumps in your neck at all? No, okay. Alright, so I'm just going to touch around, okay? Alright, I'm just going to feel over here. Can you shrug your shoulders for me, move forward? Okay. Can you swallow for me? Can you turn your head to this side? Okay, I'm just going to feel for that on the other side. Okay. Any problem swallowing at all? Okay. I'm just going to listen to your carotid artery, okay? Can you hold your breath for just a moment? Okay, go ahead and breathe. Hold your breath. Go ahead and breathe. Okay. Next, I am going to listen to your lungs. I'll start in your back, okay?
Okay.
Are you currently experiencing any pain? No. No pain? Okay. Alright, so I'm just going to take a listen to your lungs. Can you take a deep breath for me? Good. I'm just going to listen. Now, usually we would have you in a hospital gown while we listen to lung sounds and heart tones, but we just don't have those available today. I apologize for that.
Okay.
Okay. Now listen to your front lung sounds here. Take some nice slow deep breaths for me. Okay. Now I'm just going to listen to your heart sounds, okay? So you can breathe normal for this. I'm just going to listen with the other part of my stethoscope here. All right, can you lean forward for me slightly? Okay, I'm just going to listen again. Any pain when you're sitting forward?
No.
Okay. All right, so what I'm going to have you do is I'm going to just have you lean back a little bit, okay? And I'm just going to listen to your stomach, okay?
Okay.
Make sure that that sounds okay. All right, so you can just breathe normal. I'm just going to listen to the different quadrants here. While you're laying down, I'm just going to notice to see if you have any jugular vein distension too. Just going to listen to all your arteries in your abdomen area. Okay. Now look at your neck. Okay, everything looks good. I'm just going to touch around here. Does this hurt at all when I'm touching? No? I'm going to percuss a little bit and see if there's any sound changes. Does this hurt when I squeeze back here?
No.
No. Does this hurt over up in this area at all?
No.
No? Okay. All right, you can sit up, okay? I'm just going to look at your skin too and just check for some swelling. So I'm going to just see if there's any swelling. No swelling. Any numbness or tingling anywhere in your fingers or feet? No? Okay. All right. So I'm thinking, just to be on the safe side, since you've been complaining of chest pain, although you're not in any pain at the moment, I would feel better if we called an ambulance just to take you to the emergency room so they can draw some blood work and get something called an EKG where they look at the electrical rhythm of your heart. That way, if there is anything else going on, then they can intervene and prevent any further muscle damage, okay?
Okay.
So I will call for an ambulance. Is there anybody I can call for you? Is there somebody here with you today?
My husband's in the waiting room.
Okay. I will go let him know and have him come in, okay? Do you have any questions about going to the hospital at all?
I don't know right just yet. Maybe in a little bit.
I know it's a little bit overwhelming to hear this news, and if you have any questions, just let us know. Also, a couple of things I just want to go over. Some risk factors for the chest pain and to prevent any sort of further complications. Your diet, and exercise. It's important to do those types of things to keep a healthy heart, okay? Try to get outside and move around. Your BMI is a little bit on the higher side. Also, stress management. If you're having any stress with your job or anything like that, to kind of, find ways to cope with that.
Okay.
And if you need any help with that, feel free to let us know and we'll assist you in any way, okay?
I appreciate that.
Is there anything that I can do for you right now?
I don't think so.
Okay. I'll go grab your husband. If you have any questions, let me know. Otherwise, I'll be back in a little while, okay?
Okay.
All right, thank you.
You're welcome. Thank you.